Previously on Health Garage.
Women who wait and maybe begin having their first pregnancy after the age of 30, they have increased risk of developing breast cancer.
In 2018, I started to realize that that breast was growing smaller and then it had a dimpling below.
If you find there's a hard swelling in your breast, that could be something that you need to report to the nearby health facility.
You're watching Health Garage. This week on Health Garage.
Men doesn't have big breasts. Yes, they also have breasts, but they are not big as for women. But if the breast has problem, even the breast of a man will swell. You see the swelling in the breast, and when you touch, there's something hard, like there's lump there. So the breast, sometimes a man can come when one breast is like for a woman, one breast is not there. So that one indicates that a man has problem. So even men, they should check their breasts at home, though they don't go on menstruation, but they find a day in a month and they check their breasts at home. If there is any swelling, they can also touch and feel there is swelling. Then they feel something hard. Sometimes even it is painful. So they have to come to the hospital so that the hospital can bail them out from that.
Cancer in early stages doesn't have symptoms, but even when symptoms come, instead of coming to us, they first go to other areas until the judges fail. That's when they come to us.
Welcome to Health Garage. Despite efforts to combat non-communicable diseases, cases of cancer and other conditions continue to rise. Unhealthy lifestyles, poor diet, physical inactivity, and tobacco use are contributing factors. Today, we are joined by the Assistant Commissioner of Non-Communicable Diseases at the Ministry of Health, Uganda, and expert doctors to discuss breast cancer awareness and self-examination. Subscribe to our channel, follow us on social media, and let's dive into this important conversation.
I'm Dr. Gerard Mutonji. I'm Assistant Commissioner, Non-Communicable Diseases here at the Ministry of Health. Cases of cancers and other non-communicable diseases are on the increase despite our efforts. For us, this is not surprising because we've changed our the way we live. The risk factors are known. The risk factors to cancer include unhealthy diets. We are continuously eating unhealthy diets. We are no longer eating our organic foods. We are eating bad foods, starchy foods, a lot of sugar, a lot of salt, lots of fat. That's the food we are eating. Imagine these roadside foods that we are eating, fried in the oil that is reused and reused until overwhelmed. Then imagine the food that is contaminated with all the chemical that is sprayed during the gardening, poor post-harvesting methods, all that exposes us to cancer. So we are eating poorly compared to how our ancestors used to eat. And that one increases the risk of cancer and other non-communicable diseases. Secondly, physical inactivity. We are increasingly becoming physically inactive, unlike our ancestors. Now we drive to our offices, we sit in offices all through, eating the bad foods I was telling you, and when we go back home, we sit and watch TV. So we are not active, we are not giving our blood a chance to go to every part of our body to get the toxins and remove all the, that are necessary. So we are becoming physically inactive, and this one increases the risk of cancers and other non-communicable diseases. Third is tobacco use. Okay, in Uganda, I was still lucky. The tobacco use is about 10%, 12% of the adult population. But that one also exposes us to cancer and other non-communicable diseases. The other risk factor is alcohol. And you know how Ugandans can drink the alcohol. I think we are the best in Africa in terms of drinking alcohol per capita. And the drinking is increasing. And that's why we have even many mental cases in Butamika due to alcohol and other drug abuses. So all those are risk factors, unknown risk factors to these cancers and non-communicable diseases, and we know they are increasing. The other risk factor is our environmental pollution. The air we breathe is no longer as healthy as our ancestors used to breathe. It contains chemicals, the fumes, the industrial waste and all that. We are breathing that air, and it causes chronic inflammation that comes, that can result into cancers and other non-communicable diseases. So those are the main risk factors for cancers and other non-communicable diseases, and all of them, as you see, are on the increase. So we expect these cases to increase unless we change our habits. The awareness has also increased the diagnosed cases, because when you don't know, you don't go for a checkup. But now people know that you need to go for a checkup. They come for a checkup and we get the disease. So it has added on the numbers. But also, a long time ago, they used to go to herbalists and traditional healers, and they would die there without coming to our health facilities. Now that they come to our health facilities and we diagnose them, though they come a little bit late, it has also increased on the numbers. Of course, most of the cancers are present late when they are in their fourth stage, stage 4, stage 3, and that increases mortality or death rate. And why do they come late? One is that these cancers and other non-communicable diseases don't have symptoms during early stages. And that's why we call upon Ugandans to always go for a health check, even when they feel healthy. They don't have symptoms. By the time they cause symptoms, the symptoms are actually due to complications. And that's when they come. But even when they get those symptoms, they don't come to our health facilities first. They first go to herbalists, traditional healers, and when everything fails, as the disease is growing, when everything fails, they come to us when it is very late. And when they come, they die from our health facilities. And then they say, you see, when you go to health facilities, you die. And that gives them another chance for those who would be diagnosed early. They also first go to all those other places before they come to our facility. Cancer in stage 4 is not curable. So the cancer is curable in stage 1 and maybe 2A. But once it goes to stage 3 and stage 4, it's not curable. And the reason for them coming late, I've told you, it's because cancer in early stages doesn't have symptoms. But even when symptoms come, instead of coming to us, they first go to other areas until the judges fail. That's when they come to us. So when you come in stage 4, we don't have miracles. Health facilities, even when we have those machines, they don't cure cancer in late stages. So that's the reason why the mortality is very high. And I'm sure my colleagues in the Uganda Cancer Institute must have told you this. I advise Ugandans that because we are living in an unhealthy environment, because there are some things that we can't do much. About the air pollution, the what, maybe the policymakers can do that. But then there are things that we can do. You can decide to be physically active, at least 30 minutes of exercise every day. You can decide to eat healthy foods, avoiding processed foods, avoiding the sugary drinks, and instead of taking soda, taking these processed juices, you take water. You can decide to avoid tobacco, including second-hand smoke. You can decide to reduce on the alcohol or even stop alcohol, but also to check, to go for a health check every year, at least once a year. Because even vehicles don't wait until they start making noise to go for servicing. So what about you? At least once a year, go for a health check. Go to your doctor. You say, I'm not feeling anything, but I want to check my health. Then they will check your blood pressure, check your blood sugar, your blood cholesterol, your weight, your height, and advise you accordingly. That's how we can reduce these non-communicable diseases.
You're watching Health Garage.
So when you hold yourself in front of a mirror, you try to see any changes. Are the breasts, have they changed in any way? So it takes for you to know your breasts. You need to know what do your normal breasts look like. So you can stand in front of a mirror, hold your waist and look. Is there any dimpling? Is the nipple growing back inside? Is it facing a different direction? Is the skin of the breast normal? That's what you're looking out for. Then when you raise your hands up and then bring them down, you want to see if all of them come back at the same rate. If one of them comes back fast and the other takes time, then that one that comes back slowly might have a problem that you need to check out. Then the skin, how is it? Is it like the peeling of an orange with those? That's not normal. Yeah, then you need to see to it that it's checked out. But when it comes to examining, a breast begins right from this bone, this collarbone. Yes. So when you're checking, okay, like this, one hand is up, this one. So from here, right from the armpits, use the 3 fingers, and then you check all around.
What am I checking for?
Any lumps. Check for any lumps all around, and then you go all the way up to here. But from the armpit as well, because sometimes those lumps may not be in the breast but are in the armpit. So you do the same for the other. Hand up, you go around with those 3 fingers. Yes. When you're done with that, you can also lie back on a flat surface on your bed, and then still you do the same. That one you do it deeper. You want to see whether inside is there anything. Chemotherapy, it's not one of those treatments that you would want anyone to go through, because once you get the treatment, first, yeah, you can see this is not my real hair. I have no hair on the head. And then any part of the body that has hair, it will go. And then that week when you gotten the treatment, too much vomiting, diarrheating, you can have stomach aches, nausea, body weakness. Really, you feel like this life is not worth living. Yeah, it's very difficult treatment. And then, of course, the surgery, you can imagine yourself without a breast. It's not fun. Yeah, sometimes, like for me, it took me, actually after surgery, I removed the mirror from the house. It took me another 1 year to bring back a mirror into the house, because the change was, oh my, I couldn't believe this, what I was seeing in front of me. Actually, what I can say is the waiting periods have reduced. Back then, they would tell you, come, we will call you, or they will tell you come back after 1 month, 2, 3 months. Yeah, because it was one machine, everybody is waiting for it. Sometimes it breaks down and then you have to wait for it to be repaired. But now that we have a number, yeah, the waiting period has reduced. You can be mapped today and then a week later you're on treatment. But the reality is right in front of you and there's nothing much to do. You have to wait. Yeah, but it was not really easy. The nights when you just can't sleep. And because you know cancer, when you don't know about it, all you hear about cancer is it's a death sentence, and it's so scary. But yeah, I was just in disbelief because I never really expected this in my life. Never, like it's never happened at home. I've never nursed or watched somebody with cancer, so I didn't expect it at all.
You're watching Health Garage.
I'm here to demonstrate to you how you can self-breast your breast at home. So at home you can find a quiet, clean and private place, maybe in your bedroom. You expose your upper side, or upper part of the body, you expose the breast outside. Maybe if you have a big mirror at home, you can stand before that mirror, you raise up your hand. If you raise up your hand when the breasts are exposed, you will be able to see something in your breast. You can either see a demarcation where there is some isolated swelling, which you cannot see when you've not raised the arm up. So that one indicates that there is some problem. If you see that area, you can now go ahead and touch with your hand, whether you will find something hard like a bean seed, either it is a firm swelling or mobile. all those ones indicate there is some problem unless proved in the hospital that it is not. So we women, we always advise to check our breasts on monthly basis. You can get your piece, because we women, we can go on period. After your period, like 7 days after your period, that is a very clean side and very clear time of checking your breasts. So when you're checking your breasts, what are we looking for? You are looking for something hard in your breast. Before you start even touching your breast, you first look at your breast. Are the two breasts the same in size? Are the nipples pointing or sucking down? Are the color of the breast the same? Is there any swelling like exposed, you are able to see it? Is there any wound on your breast? So as you go to check on your breast, you raise up the hand or you put your hand on your waist. So the right hand is going to palpate the left breast, and the left hand is going to palpate the right breast. So you go on. As you are palpating your breast, we use this. You put your hand like this. You don't use the nipple to touch like this. This is wrong. You use the middle of the finger as you go around your breast like this. You are looking for something hard, like bean seed. You are looking for something hard. You go around the breast, go around the breast, go around the breast. Then the left arm will go the same way at the right breast. You touch your right breast. You go around. You go round, you are looking for something hard. Is there anything hard somewhere? So as you go round the breast, you still go at the armpit, because the tail of the breast is on the armpit. So you touch the armpit. Is there any swelling here? Is there anything swelling at the armpit? You're also looking for that swelling at the armpit. Have you finished there? You can get a white cloth or any cloth which is not black. You are going to squeeze the nipple of the breast. Not so much. You do small like this with your gauze or with your white tambara to see whether there is anything. Are you seeing anything in this white cloth? If there is anything, is it a milk breast? If it is a milk breast, it's okay, it's normal. Is it watery? If it is watery, it's even normal. What are we looking for? If you see something like coffee brown thing coming from your breast, that one indicates there's problem inside the breast there. And if something is coming out like pus indicate there is some problem there. So when you go around and there is nothing, we advise all the women in their reproductive ages to do this test every month after your period. 7 days after your period, you go and self-exam. You do your self-exam of the breast to see whether there is any problem. If you see any problem or you touch any swelling, don't sit at home. Come to the hospital and we prove whether that swelling is normal or not normal. So we do our exam again from the hospital. If we find anything, we thank you to go and do some ultrasound scan of the breast, or we go for mammogram. They send you to go and do the mammogram, and they see if there's any problem. We go ahead, do biopsy. If they do the biopsy and the result comes out that it is positive for cancer cells, we enroll you on treatment in the Uganda Cancer Institute. The breast which is normal should be the same in the size. So sometimes one side of the breast is slightly bigger than the other one, but it should not be very big, abnormally big. So because when you are looking for this thing, or you see some bruises or wound on the breast, and that wound, if you touch it, is it a bruise or the wound is coming from inside, from the swelling inside? Because when you overstay with your swelling, sometimes it bursts by itself, so it causes the wound. As you're coming to the hospital, there's oozing wound in your breast. So the normal breast should be, the nipple should be pointing, because sometimes you look at the nipple and one nipple is being drawn inside. It is pushing inside. So that one indicates there is problem. There is something pushing that nipple to go inside. It should be pointing. That is normal breast. Okay. Yes. No, even at men doesn't have big breasts. Yes, they also have breasts, but they are not big as for women. But if the breast has problem, even the breast of a man will swell. You see the swelling in the breast, and when you touch, there's something hard, like there's lump there. So the breast, sometimes a man can come when one breast is like for a woman, one breast is not there. So that one indicates that a man has problem. So even men, they should check their breasts at home, though they don't go on menstruation, but they find a day in a month and they check their breasts at home. If there is any swelling, they can also touch and feel there is swelling then they feel something hard. Sometimes even it is painful. So they have to come to the hospital so that the hospital can bail them out from that. Now, for the breastfeeding mothers, sometimes they have infections which can be treated, which is not cancerous. So the breastfeeding mothers, most of the time when they come with those complaints, we send them to the postnatal clinic, because when they send their children there, maybe for immunization, maybe for those people in the postnatal clinic can handle them there. If there is anything alarming, they will be able now to write for them consultation to Uganda Cancer Institute. But most of the time in the breastfeeding mother, those are infections which can be treated from there. As a woman, you're going on your piece. There are many things that comes on your breast because of hormonal imbalancing. You can find your breast very painful. That's why I have told you, if you're on your piece, you don't check your breast. 7 days after your period, you check your breast. There you are okay. But if you check your breast when you're going to your period or immediately after your period, you feel so many things which can confuse you, and they are not cancerous. So don't check your breast when you're on your period or you are some days on your period. Check your breast 7 days after your period. So, and when you're checking your breast, don't use the fingertip like this. This fingertip will touch many things which are not really cancerous. Use the middle of your finger as I have demonstrated, like this. Put your middle finger, go around your breast, like I've demonstrated it here. Don't use this, because if you use this, you can find so many things which can scare you over nothing. So use the right procedure as you are checking your breast. The middle, not the tip. So if you find anything hard when you're using the middle, that one can raise dust. Then if you get anything there, don't sit home. Come to the hospital for clarification. And when you're coming to the hospital, I'm advising all the women outside there, don't go to a clinic as coming for cancer screening. Don't go to a clinic. Come to a main hospital where the people who are expert, who are trained, who knows what they're looking for to help you out. You go to the clinic, you're wasting time. So come to the main hospital and they give you the right advice from the hospital. For those cases of the women who have delivered and maybe their children died, or for those one who has miscarriage and the breasts become big abnormally, sincerely, that one is not caused by cancer cells. It is because when the woman is pregnant, the breast has been tuned to breastfeed the baby. So now the breast was ready to breastfeed. It's bringing out milk. But unfortunately, the child who was supposed to benefit from that breast died. So that milk keep coming. It is engorged. The breast looks swollen and it is painful. So that one can be treated in the hospital. Maybe where the woman has given birth from, they can give some antibiotics, or they can treat that one there. It is not cancer that caused that. It was because of the woman has conceived, the breast has been prepared to breastfeed the baby. Unfortunately, the baby died. So now that breast keeps on and it is engorged, and the breast of the mother becomes big. That one can be treated and the breast goes back to the normal size. As we have talked screening, self-breast exam at home is very important. If you cannot do the self-exam at home yourself, make sure you frequent the hospital, because we are there to help you. When you come to the hospital, we shall always check your breast. But if you can do it at home, follow the advice we are giving you. Every month after your period, 7 days after your period, check your breast. If you find anything, don't sit at home. Just rush to the hospital so that you are helped. So that when there is anything, is early detected and enrolled on the treatment, so that the good outcome.
Thanks for tuning in to Health Garage. Remember, early detection and proper medical attention can save lives. If you can't self-examine at home, visit a hospital. Otherwise, perform a self-examination 7 days after your period. If you notice anything abnormal, seek medical attention immediately. Don't forget to like, subscribe, and follow us on social media for more health tips and expert insights. Join us next time on Health Garage.
The Health Garage, transforming lives one healthy choice at a time.